Doctor's warning. If you're 70 or 80 and still masturbate, I'm sorry to tell you 7 things. Hey there, welcome to the channel. Now, this might be a topic that makes some of you feel a little uncomfortable, but trust me, it's an important one. If you're in your 70s or 80s, and you're still engaging in a very natural but sometimes taboo topic, masturbation, this video is for you. I'm not here to judge, but as a doctor or health expert, I need to level with you. There are a few things you absolutely need to know. We've all heard the jokes and the whispers about older people and sex. Society likes to pretend that once you hit a certain age, your sexual health just disappears. But we both know that's not true. Sexuality doesn't expire just because the number on your birth certificate keeps increasing. In fact, taking care of yourself, staying in touch with your own desires and needs, that's a huge part of maintaining your overall health and well-being. But here's the thing. With age, the way we experience our bodies and what's safe or harmful, it does change. So, if you're in your golden years and still engaging in masturbation, there are some important things you need to consider. It's not about shaming you. It's about empowering you with the knowledge to keep enjoying life safely, respectfully, and most importantly, healthily. Today, I'm going to walk you through 7 crucial things you need to know if you're in your 70s or 80s and still masturbating. You'll want to listen closely, because these are things you might not be hearing from your doctor or loved ones. I'm here to share the honest truth, with no sugarcoating. So, let's dive in. And remember, no matter your age, your health matters. Let's break down these barriers, because sexuality is part of who you are, at every stage of life. Part 1. The first thing. Physical health and masturbation in older age. Now, let's talk about the first thing you need to understand when it comes to masturbation in your 70s or 80s, your physical health. You've probably noticed that as you get older, your body changes, sometimes in ways that you don't expect. That doesn't mean you should feel ashamed or like you've lost something. It just means your body needs a little more attention, a little more care. And when it comes to sexual health, that's no different. Masturbation is a very normal and healthy part of life, but as we age, it's important to be mindful of how our bodies react. Here's the truth. Our hormones change. As women, you might experience menopause, and for men, testosterone levels drop. This can lead to a decreased libido and changes in how sexual stimulation feels. But this doesn't mean your sexual health or enjoyment has to disappear. What it does mean is that you may need to adjust your expectations and approach. In your 70s and 80s, you may also have chronic conditions, arthritis, heart disease, diabetes, that can affect your physical ability to engage in certain activities, including masturbation. You could find that movements that used to be easy now cause discomfort. Maybe your hands, joints, or even your lower back are stiffer than they used to be. But the good news? There are ways to adapt. For example, if joint pain is an issue, there are specific positions and techniques that can reduce strain. If you have trouble with mobility, using supportive pillows or cushions can help you feel more comfortable. You can also use more lubrication, which not only makes everything smoother, but also reduces friction that could lead to irritation. But here's the key. Listen to your body. Masturbation should never hurt. If it does, it's time to stop and reassess. Maybe the method you've been using isn't right for you anymore. Maybe your body needs more rest or more support. It's okay to change how you approach it. Just like with any other aspect of health, adaptation is the name of the game as you age. And one more thing, overexertion is a concern. When we're younger, we may not think twice about physical stamina. But as we age, too much can lead to fatigue or injury. So it's important to remember that moderation is key. There's no rush, and there's certainly no need to push yourself. Personal reflection. I want to take a moment to say that this whole idea of adjusting isn't about losing something. It's about finding new ways to experience pleasure that are right for you. I've had conversations with many people in their 70s and 80s who still enjoy their sexuality and find new ways to engage with their bodies. It's empowering to see people embrace their changing bodies, rather than fight them. Remember, your body deserves care and respect, and that includes understanding what it can and can't do now. Takeaway: masturbation in older age can still be enjoyable, but it's important to be mindful of physical limitations. Your body is different than it was decades ago, but that doesn't mean it can't still bring you pleasure. Listen to your body, make adjustments, and find what works for you. Part 2. The second thing: mental and emotional health considerations. Moving on to the second thing you need to consider: mental and emotional health. Now, when we talk about masturbation, we often focus on the physical aspects. But here's the thing: mental and emotional health plays a huge role in how you experience and feel about masturbation as you get older. You see, it's not just about the physical act, it's also about how you feel about it, and that's what makes all the difference. In many cultures, we've been taught that as we age, certain things, especially things related to sexuality, should be put away or ignored. That's a huge misconception. Sexuality doesn't disappear with age, and neither does the need for intimacy or self-care. However, as you get older, you might start to feel a bit conflicted about masturbation. You might wonder, is this normal at my age? Am I doing something wrong? Here's the truth: it's perfectly normal. In fact, masturbation has mental and emotional benefits. When you masturbate, your body releases endorphins, those feel-good hormones that help reduce stress and anxiety. It can be a form of emotional release, especially if you're dealing with the pressures of aging, loneliness, or any other emotional challenges. Many older adults find that self-pleasure is a way to experience comfort and relaxation. But here's the tricky part. For some people, especially as they get older, there's a feeling of guilt or shame. The cultural stigmas around sexuality in older age can sometimes creep into your mind. You might think, is this weird? Shouldn't I just be focusing on other things at my age? And that's where we need to break the stigma. You deserve the same emotional and physical satisfaction at 70, 80, or beyond as you did at 20. Masturbation can be a way to maintain a connection with your own body. Remind yourself that pleasure and self-care don't end with age. Embrace the freedom to explore your body, discover what still works for you, and enjoy those moments without shame. Personal reflection. When I talk to older adults who are exploring their sexuality, it's always interesting to hear the emotional journey. There's often a sense of rediscovery, like, hey, I'm still me. And I think that's something we need to be proud of. Feeling good in our bodies isn't limited by age. The emotional comfort that comes from masturbation can provide a sense of peace and self-love. And honestly, it's amazing to see people embrace that. Takeaway: masturbation isn't just physical, it's deeply tied to your mental and emotional well-being. If you feel guilty or ashamed, remember, it's normal to enjoy self-pleasure at any age. Embrace self-care. It's a powerful tool for emotional release and stress reduction. Part 3. The third thing: relationship with your partner. Now, let's dive into the third thing you need to consider when it comes to masturbation in older age: your relationship with your partner. When you're in your 70s or 80s, your relationship with intimacy might look a little different than it did in your younger years. Maybe physical intimacy has changed due to health concerns or simple life changes. Perhaps your sexual drive isn't what it used to be, or maybe your partner can't engage the same way. And that's okay. It's completely normal to go through those changes. Masturbation may then become a way to navigate these changes while maintaining a healthy connection to your own sexual health. Here's the thing: masturbation isn't just an individual activity. It's possible that you've been sharing intimacy with a partner for many years, and as things evolve, it's important to keep the lines of communication open. Masturbation doesn't have to be a secret or something to hide. It can actually be something that enhances your relationship if you approach it together. If you're in a long-term relationship, it's likely that you and your partner have already gone through many changes together. And while intimacy may change as you both age, it doesn't mean that connection has to disappear. Talking about masturbation with your partner can help build mutual understanding and respect. It's not about replacing them or reducing your intimacy. Rather, it's about enhancing it in ways that are sustainable for both of you. For instance, if you or your partner experience health challenges that make physical intimacy more difficult, masturbation can offer a sense of pleasure and release that doesn't require as much physical effort. It's a way of maintaining some form of connection when the usual forms of intimacy are harder to engage with. It can even spark a conversation about how to maintain intimacy in other ways, like holding hands, cuddling, or finding other non-sexual ways to stay close. Personal reflection. I've spoken with many couples who, as they've aged, have learned that their connection doesn't just lie in traditional forms of intimacy. They've realized that it's about support, understanding, and communication. And when masturbation is approached openly, it can actually bring couples closer. It's about sharing your needs with each other, not keeping secrets. And remember, intimacy is about the bond you share, not just the physical act. Takeaway. Masturbation doesn't have to take away from your relationship. It can enhance intimacy in a healthy way. Open, honest communication about sexual health and needs is key to maintaining closeness. Your partner can be your ally in understanding your needs and adapting to changes in intimacy. Part 4. The fourth thing: potential health risks and how to avoid them. Now, let's talk about the fourth thing you need to be aware of: health risks associated with masturbation in older age and how to avoid them. Masturbation is a completely natural and normal activity at any age, but like with any activity, there are certain health risks that can become more pronounced as we get older. These aren't necessarily deal breakers. They simply require a bit more awareness and care. One of the main risks for older adults involves physical injuries. Let's be real. Our bodies don't move the same way they did when we were younger. If you have joint pain, arthritis, or muscle weakness, certain positions or movements may put stress on your body and lead to strains or discomfort. So, it's important to be gentle and conscious of your body's limits. This is where comfort becomes essential. Use supportive pillows, cushions, or even adjustable chairs to help find positions that work best for you without causing strain. Another important point is lubrication. As we age, our bodies produce less natural lubrication, and this can lead to friction and irritation. So, always use a high-quality lubricant to make the experience smoother and more comfortable. There's no shame in using extra help. Lubrication can help reduce irritation and even enhance the overall experience. For men, there are some unique health risks to keep in mind as well, particularly when it comes to the prostate. If you have a history of prostate problems or urinary issues, excessive stimulation can sometimes lead to discomfort. That's why it's important to listen to your body and avoid overdoing it. Lastly, heart health is something you should always keep an eye on. If you have cardiovascular conditions, it's crucial to stay mindful of exertion levels. Masturbation can elevate your heart rate, so be sure to approach it slowly and gently. If you're unsure, consult your doctor about any specific concerns you might have regarding heart health and sexual activity. Personal reflection. As we age, we sometimes forget that our bodies still need care and attention, even when it comes to simple things like masturbation. I've worked with many older adults who, at first, felt embarrassed to ask about this, but in reality, the key to enjoying yourself, whether alone or with a partner, is taking care of your body and finding what works for you. Everyone's body is different, and adjusting accordingly makes the experience far more enjoyable and risk-free. Takeaway. Physical health risks can arise as you age, but they can be minimized with awareness and the right adjustments. Lubrication is essential for comfort and reducing friction, so don't hesitate to use it. Always listen to your body. Moderation and adaptation are key to keeping masturbation a pleasurable, healthy experience. Part 5. The fifth thing. Understanding your sexuality as you age now. Let's talk about something that's close to the heart for many: your sexuality as you age. This is the fifth thing you need to understand when it comes to masturbation in your 70s or 80s. We've all been conditioned by society to think of sexuality in a very certain way, and as you get older, there can be this notion that your sexuality fades, that it's somehow not appropriate or not needed anymore. But here's the truth. Your sexuality doesn't disappear with age. It evolves. Yes, you may notice physical changes. Libido may not be what it once was. You may not be able to perform in the same way, or the act of sexual pleasure may feel different. But that doesn't mean it's gone. If anything, this is an opportunity to rediscover your sexuality in a way that feels good for you at this stage of life. Your desires, your pleasures, they're still valid, and they're still part of you. They might just look a little different, and that's okay. Sexuality is personal, and it's about so much more than just the physical act. It's about self-expression, connection, and the ability to feel good in your own body. So, rather than thinking of your age as an obstacle, think of it as an opportunity to redefine what sexuality means for you. For example, you may have more time now to explore what really feels good, without the rush, the pressure, or the obligations of earlier years. Masturbation can be a great way to reconnect with your body and experiment with new techniques or pleasures that work for you. And who knows? You might discover something that feels even more satisfying than it ever did before. And let's be real for a moment. Self-pleasure is a form of self-care. In a world that can sometimes make us feel like we're irrelevant as we age, reclaiming your sexuality can be an incredibly empowering act. It's not about youth. It's about confidence, acceptance, and joy in your own skin. The pleasure you experience now can be just as fulfilling as it ever was. Personal reflection. As I've talked with older adults, there's often this moment of rediscovery. It's like watching someone realize that their body is still theirs to enjoy, at any age. And I think that's so beautiful. We live in a world where youth is idolized, but there's something incredibly empowering about embracing who you are, exactly as you are. Your body, your desires, they're still yours, and they still matter. Takeaway. Your sexuality evolves as you age, but it doesn't disappear. It's still a valid and important part of you. Rediscovering your desires and pleasures at this stage can be incredibly fulfilling. Embrace the empowerment that comes with reclaiming your sexuality. Age doesn't take that away. Part 6. The sixth thing, navigating social stigma and taboo. Now, let's tackle the sixth thing that often holds many older adults back from fully embracing their sexuality, social stigma and taboo. Here's the truth. There's a lot of shame and embarrassment tied to the idea of older adults, especially those in their 70s and 80s, still being sexually active. Society often wants to sweep this aspect of life under the rug once you hit a certain age. But here's where we need to challenge that belief. Sexuality doesn't have an expiration date. We live in a world that is still uncomfortable with older adults being sexual. For many, the thought of someone in their 70s or 80s enjoying self-pleasure can seem odd, inappropriate, or even laughable. But this is society's issue, not yours. The stigma surrounding aging and sexuality often comes from outdated cultural beliefs. In reality, people of all ages should have the freedom to express their sexual needs without fear of judgment. Here's where education comes in. As older adults, it's important to break down these barriers and normalize the conversation. Sexuality at any age should be celebrated, not shamed. We need to educate the younger generation to understand that age doesn't mean the end of sexual exploration or self-expression. In fact, it can be an exciting new chapter. If you're concerned about feeling judged or ashamed of your masturbation habits, I want to remind you of something very important. Your sexuality is yours. No one has the right to make you feel bad about it. If you're comfortable talking to a doctor about your health, then you should also feel empowered to talk openly about your sexual health. Remember, self-pleasure isn't about secrecy or shame. It's about self-care. And there's nothing shameful about caring for your own body and experiencing pleasure, no matter how old you are. Personal reflection. I think about all the older adults I've encountered who've been told, "You're too old for this," or It's not appropriate for people your age to be sexually active, and I've seen the internal struggle it causes. It saddens me because I know that sexuality is universal, no matter what your age. As I've seen firsthand, the more we open up the conversation and challenge these stigmas, the more empowering it becomes for everyone involved. Takeaway: sexuality at any age should be normalized, not shamed. It's a natural part of being human. Challenge the stigma around older adults and sex. Your pleasure is not a taboo. Self-empowerment comes from breaking free of shame and embracing your sexuality. Part 7. The seventh thing. When to seek medical advice. Now, let's talk about the seventh and final thing you need to know about masturbation in your 70s or 80s. When it's time to seek medical advice. Masturbation is a natural and healthy part of life, but there may come a time when you notice something that doesn't feel quite right. It could be physical discomfort, emotional distress, or maybe you've just noticed that the experience has become uncomfortable or unusual in some way. The most important thing here is that it's okay to ask for help. And if you're unsure about whether something's normal, or if you're experiencing something new or troubling, it's crucial to talk to a healthcare provider. So, when should you reach out to a doctor? Physical pain. If you experience consistent or severe pain during or after masturbation, whether it's in your joints, muscles, or elsewhere in your body, that's a red flag. Sometimes pain can be the result of overstimulation, improper technique, or an underlying health condition like arthritis or nerve issues. It's not normal to feel pain every time you engage in self-pleasure, and your doctor can help you pinpoint the cause and suggest alternatives or treatments. Changes in libido or sexual function. If you notice a significant and sudden change in your libido, such as a sharp decrease or complete loss of interest in sexual activity, it might be worth consulting a doctor. This could be due to physical health changes, like changes in hormone levels, or it could even be related to depression, medication, or stress. While it's common for libido to decrease as we age, an abrupt or extreme drop could signal something more serious that needs attention. Erectile dysfunction or difficulty achieving orgasm. If you're a man and you're experiencing erectile dysfunction, ED, or you find it more difficult to achieve orgasm than before, you should bring it up with your doctor. ED is common as men age, but it's important to rule out other health issues, such as cardiovascular problems or diabetes, that may be contributing. There are many effective treatments for ED, so there's no need to suffer in silence. Likewise, for women, vaginal dryness or difficulty achieving orgasm may also benefit from a medical consultation to discuss possible treatments like lubrication, hormone therapy, or other therapies to improve sexual function. Mental health concerns. Sexual health is deeply intertwined with mental health. If masturbation or your sexual thoughts are causing you stress, anxiety, guilt, or shame, it's important to address these feelings with a mental health professional. It's also worth consulting a therapist if you feel like your sexual health or self-pleasure habits are getting in the way of daily life or your relationships. Sometimes, it's not about the physical side of things. It's about addressing emotional or psychological barriers that are impacting your sexual well-being. Difficulty with hygiene or cleanliness. If you're having trouble maintaining hygiene during or after masturbation due to physical limitations, that's another area to seek advice. Maintaining proper hygiene is important to prevent infections, irritation, or discomfort. If you find it difficult to clean yourself properly, there are ways a healthcare provider can assist, whether it's by recommending special products, techniques, or even equipment to help you maintain cleanliness. Prostate concerns. For men. For men, it's especially important to keep an eye on prostate health. If you have a history of prostate issues, or if you notice symptoms like pain in the pelvic region, difficulty urinating, or blood in the urine, you should see a doctor. These can be signs of prostate problems, including prostate cancer. Masturbation can sometimes exacerbate symptoms of prostate issues, so don't hesitate to bring it up with your doctor to ensure you're managing your health properly. Urinary issues, for women and men. If you notice that masturbation is causing or exacerbating urinary issues, such as frequent urination, discomfort, or incontinence, this might indicate a urinary tract issue or pelvic floor weakness. It's essential to seek medical guidance if these symptoms appear to ensure proper treatment. Personal reflection. In my work, I've seen many older adults who are reluctant to discuss these concerns with their doctors because they feel embarrassed or think it's too late to ask. But let me tell you this. It's never too late to care for yourself. If something feels off, or if you're noticing changes, your health matters, no matter your age. Talking openly with your doctor about your sexual health can not only help prevent issues down the line, but it can also lead to better, more fulfilling sexual experiences. A lot of people think that getting older means putting certain aspects of life away. But I believe that being proactive about your health, mental, emotional, and physical, is key to living a long, happy, and healthy life. Don't be afraid to reach out to your healthcare provider and have those conversations. The more we talk about these things, the less stigma there is around them, and the more empowered we all feel. Takeaway: if you notice any pain, changes in libido, difficulty achieving orgasm, or emotional distress, it's time to seek medical advice. Physical health issues, such as erectile dysfunction or urinary problems, can often be treated or managed with proper guidance. Mental health is just as important. If you feel shame or guilt, seek support from a professional. Proactive healthcare is essential at any age. Don't be afraid to reach out to your doctor if something feels off. Conclusion. So, there you have it. The 7 things you need to know about masturbation when you're 70 or 80. These are truths, not just about physical health, but about self-respect, empowerment, and well-being. You have the right to experience pleasure at every stage of life. It's about finding what works for you, embracing changes, and being kind to yourself as you continue to age gracefully. If you've learned something new today, or if you've been encouraged to have that conversation with your doctor, I'm glad we could start this important discussion together. Remember, your sexuality doesn't fade away, it evolves, and it's always worth taking care of. Don't forget to like, share, and subscribe if you want more conversations like this. And if you have any thoughts or questions, drop them in the comments below. Let's keep the conversation going.